Hi, Ms. Dixon. My name is Ashley Lucius, and I'm going to do your physical assessment. If you have any questions, just let me know, but first I'm going to start with your vital signs. Okay, you're on. Okay, your blood pressure is 104/64, your heart rate is 94, your temperature is 97.1, and your pulse ox is 99%. All of those are normal. So next we'll step over onto the scale and we'll get your weight. You just step up here. Okay, your weight is 138.6. And then if you lay in the bed, I'll get your height. Okay, according to this, you're 5'9". Does that sound about right?
Yes.
Okay. Okay, if you could go back over to the chair, we'll. Okay, so I can see that your skin is warm and dry. There's no lesions or ulcerations or rashes. I'm gonna feel your skull here. Your skull is intact. There's no depressions or tenderness, correct?
Mm-hmm.
Your hair is clean and remains intact. Next, I'm going to ask you to clench your teeth, smile, wrinkle your forehead, puff out your cheeks, and then stick out your tongue. I'm going to touch the bones of your face. Is there any pain?
No.
Okay. Next, I'm going to palpate your sinuses. Do you have any pain when I do that?
No.
Okay. Next, I'm going to palpate your temporomandibular joint. So if you could open and then close. Is there any pain?
No.
I feel no crepitus when you do that. And then I'm going to use this cotton ball to test sensation on your forehead, so just tell me every time you feel it. And then on your cheeks. And your chin. Great. Next, we're going to move on to your eyes. I can see that your eyelids are smooth, your lashes are even, and there's no erythema or exudate from your eyes. Could you close your eyes lightly for me? There's no tremor in your eyelids. I'm going to just look at your conjunctiva here. Okay, could you just open your eyes? Your conjunctiva is translucent. There's no redness or exudate from your eyes. I'm going to test your pupillary response. So if you could just look straight forward, I'm going to shine this light into your eye to see that your pupils are reacting to the light. Okay, that pupil is round and reactive to light. This one is as well.
Okay.
Okay. All right. So right now I'm just going to palpate around your eyes. This is your lacrimal apparatus. There's no pain or tenderness. And then your lacrimal gland, no pain or tenderness. And then we're going to test your the 6 cardinal fields of vision. So if you could just follow my hand or my finger with your eyes and not move your head. First we're going to go diagonal. And then we're going to look straight up and then straight to the floor. Good. All right, next I'm going to test your red reflex. So I'm going to look in your right eye with my right eye and your left eye with my left eye. Okay? Just look straight forward. Okay? This one. Good. Next, we're going to move on to your ears. Okay. First, I'm just going to feel your ears here. Everything is smooth as intact. There's no pain. And they are symmetrical on your face. I'm going to look into your ears with this light. Not with that. Good. Your tympanic membrane is clear and I can see it clearly. This one is not as visible due to some earwax. Next, I'm going to use this tuning fork to test bone and air conduction. So the first time I'm going to put it in the middle of your forehead. You just tell me if you can hear it better in one of your ears or if it sounds about the same.
Same.
Okay? Which is normal. The next one I'm going to do, I'm going to put it in the front of your ear and then in the back and just tell me if you can hear it.
Yes. I can hear it.
Okay? And then we're going to move on to the next ear.
I can hear it.
Okay. And then next we're going to do a whisper test. I'm just going to whisper a word into your ear. If you could just repeat it to me.
Pineapple.
Okay?
Pen.
Okay, great. All right, moving down, we're going to look at your nose. I can see that it's intact. Your septum is midline to your face. There's no deviations. So I'm going to test the patency of each nostril. What I need you to do, I'm going to do is occlude one of your nostrils and then you breathe in and out through the other. Okay, and then we'll move to the next one. Great. Now I'm going to look into your nose with this pen light, just examining the structures. Okay, it's clear of turbinates and the mucosa is intact. Next, I'm going to look into your mouth. Okay. You can just open. Your mucosa is intact. None of your teeth are chipped. All teeth are present. You could lift your tongue. Good. And then stick out your tongue. Tongue is smooth and pink. And then say ah. And then get reflex. All right, next we're going to move on to your neck. It is symmetrical. I can't see any lesions or masses at this time. So first I'm going to palpate for your trachea, which is midline. Okay, so like I said, your neck is smooth. There's no, I cannot see any vein distension in your neck. Your trachea was midline. Next, I'm going to palpate for your thyroid gland. I'm going to do this behind. And then could you swallow? Okay, and I could feel it move as you swallowed. Next, I'm going to test your range of motion. So first, could you just shrug your shoulders for me? Good. And then can you look to the left, and then look to the right, and then look up, and then look down. This time I'm going to put a little bit of counter pressure as you do each one of those tasks. So could you look to the right? Good. And then could you look to the left, and then up, and then down. Great. So next I'm going to start with your lymph nodes. First I'm going to start with your occipital, which is in the back of at the base of your occipital bone. Good. And then your posterior auricular, and then your preauricular, your tonsillar, your submandibular, and then your submental. Next is your superficial clavicle, which is along this muscle right here. Your posterior clavicle, your deep cervical, and then your supraclavicular, which is all along here. And all of those are normal and could. Next, I'm going to feel for your carotid pulses, one at a time. Okay. Pulse is smooth and strong. Next, I'm going to auscultate your carotid pulses and your thyroid. We auscultate the thyroid to make sure that there's no bruit present. Okay, next I'm just going to take a look at your arms and the skin on your hands and arms and your fingernails. Your skin is warm and dry. Like I said previously, there's no lesions or ulcerations, no rashes present. Your fingernails are smooth. The edges are rounded and not jagged. Your capillary refill is less than 3 seconds. And then I'm going to assess your radial pulses, which are down here. Pulse is smooth and strong. Oh. Fix the camera here. Okay. I'm going to reassess your pulses here. Okay. And then next I'm going to look for your brachial pulse, which is right inside the elbow here. And again, it's smooth and strong. Great. And now I'm going to ask you to sit on this stool so that we can take a look at your back. And if you could just spin around for me. Okay, so I'm going to take this down a little bit. So the skin on your back is smooth and intact. I'm going to palpate the costovertebral angle. And then I'm going to percuss, and you just tell me if you feel any tenderness or pain when I do this.
No.
Okay, great. Next, I'm going to inspect your respiration, and I can see that it is smooth and easy and unlabored. And then what we're going to do, I'm going to inspect for, or palpate for expansion. So I'm going to do this in the back, and then we'll turn around and I'll do it in the front. So if you could just take a few normal breaths in. Good. And this is just measuring the deepness of your breathing. And my fingers do separate and then go back together during inspiration. And then if you could just spin around. Okay, now that you've turned your gown around, I'm going to check for expansion in the front, just like I did in the back. Okay, and now I'm going to listen for tactile fremitus. So every time I move my hand, could you just say 99?
99, 99, 99, 99, 99, 99.
Okay. So what we're going to do next is we're going to spin around, and I'll let you put your gown to the back again. We're going to assess for tactile fremitus in the posterior, and then I'm going to palpate after I do that. Okay, next I'm going to assess for tactile fremitus in the posterior chest. So just the same as the front, every time I move my hand, just repeat 99.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, and now I'm going to percuss along your posterior chest wall. Okay, and next I'm going to percuss the lateral chest wall. And lastly, I'm going to test for diaphragmatic excursion. So for the first part of this test, I need you to inhale and hold your breath. So if you could take a breath in and hold it. And I'm going to mark on your back where I hear the change in sound. And then next, I need you to exhale all of your air out and hold it out. Ready? Go. Okay, you can go ahead and take a breath now. I'm going to mark there. And I'm going to measure the distance between the two. And it is 4 centimeters, which 3 to 5 is normal. I'm going to do the same thing on the other side. So go ahead and take a deep breath in. And then let the air out and hold it. Okay, I'm going to go ahead and measure these two numbers as well. And the distance between the two is 4 also, which is a normal finding. Next, I'm going to auscultate your posterior chest sounds, comparing side to side. Okay, and what I listened for on the left, on the sides of your body was your lateral chest sounds. So next I'm going to have you turn around and I'm going to auscultate your anterior chest sounds. Comparing side to side still. Okay, all your lung fills are clear and your breath sounds, there's no diminishing in the basses. Next, we're going to move on to the inspection of the anterior chest. First, I'm going to notice the skin and the symmetry of the chest. Skin's intact, no scars. I don't see any pulsations or heaving. Respiratory effort looks easy and unlabored. I'm going to next palpate the chest wall. Okay, and now I'm going to palpate the precordium and the chest wall, and then the left chest to locate the apical pulse. Okay, and now I'm going to locate the apical pulse. And next, I'm going to percuss all of these areas. Okay, and now I'm going to auscultate all of the heart sounds and the breath sounds. I listened for aortic, pulmonic, tricuspid, and mitral cardiac sounds. And next I'm going to have you sit up so that I can assess your infraclavicular and axillary nodes. And if you could just swing around so that your feet are hanging over. Okay, so first I'm going to assess for your infraclavicular. Using the pads of my first two fingers and rotating. And then next I'm going to have you lift your arm. And I'm going to just kind of support it and just kind of relax it. Switch it here. And then I'm going to palpate your axillary lymph nodes. So I'm going to go all along in here. Again with the pads of my two fingers in a rolling motion. And then I'm going to switch and come over to this side. Same maneuver. Support your arm with this hand and then rolling motion. Okay. Okay, now I'm going to do your abdominal exam. So if you could lay back down. So first I'm just going to inspect the skin, again, of your abdomen. Everything's intact, no surgical scars, no rashes or lesions or wounds. Next I'm going to listen to all 4 quadrants of your belly to listen to your bowel sounds. Next, I'm just going to percuss for tone. The sound gets duller over your liver, of course. And then I'm going to lightly palpate. You just tell me if you can feel if there's any pain or tenderness.
Okay.
And then now I'm going to deeply palpate. Again, just tell me if you feel any pain. Okay. And now we're going to move on to your feet and legs. I can see that your skin is intact. There is even hair distribution on your legs. I'm going to palpate the temperature. Your skin is warm and dry. There's no edema present. I'm going to check your pulses. So dorsalis pedis. And then posterior tibial. Hold on. Let's do that again. I'm going to palpate your pulses, dorsalis pedis. And then posterior tibial. And then your popliteal, which is behind your knee. And then I'm going to follow this up with your, okay, now I'm going to assess for sensation. So can you feel this?
Yes.
And then let me see your hands.
Yes. Yes.
And then next I'm going to test for 2-point discrimination. So I'm going to put this on your hand and then the bottom of your feet. You tell me if you feel it 2 or 1.
Mm-hmm. 1, 2, 1, 2.
Okay. Then I'm going to go ahead and do it on the bottom of your feet as well.
2, 1, 2, 1.
Okay. And then I'm going to test your muscle strength. So if you could push down on my hands and then pull up. Good. And then I'm going to test your grip strength. So if you could just squeeze my hands. Great. And then push against and then pull against. Great. And lastly, I'm going to test your reflexes, your brachial, your knee, and then your Achilles tendon. Okay, now we're going to do the reflexes of your knee and your Achilles tendon. So I'm just going to hit this with this hammer and just feel for your reflex. Okay, and now I'm going to come down and just do the same thing on your Achilles tendon. And then we're going to move Move up and do your brachial. For this, I'll just support. No, don't bring it full out. Kind of relax it a little bit. And then we'll test on the back. Okay. A little bit here. Kind of relax just a little. Okay. And then lastly, we're going to test, I'm going to take a look at your cervical spine. So let me just lower you down a little bit. And if you want, you can switch the gown to the front so that we can see your back. So if you could just turn around for me. I'm going to inspect the cervical spine. It looks straight and aligned. There's no pain as I press? And just go all the way down. And I'm going to have you bend at the waist. And as you can see, her spine is straight and there's no deviations or scoliosis present. And then you can stand back up. And then we are finished.